Okay, so I'm going to talk about femoral neck stress fractures. So pretty much what we found in the research is that there's two different types of patient presentation. So you have your typical and your atypical. So your typical is going to be your younger active population, whereas your atypical is going to be like the older frail lady type patient. So for atypical, you're looking at a patient who is 69 plus or minus 8 years of age. Female, um, Females are more common to have this condition than males. And again, your atypical patient, you're looking for significantly older, shorter, weighs less, so lower fat mass and percentage fat mass. For your typical presentation, running athletes, so track and field, marathon, distance, as well as military recruits. And some biomechanical factors to look at are leg length discrepancy, previous lower extremity injuries such as ankle sprains and things like that, and foot abnormalities, for example, flat foot, and coxivera. So that is where the femoral neck has a lesser degree in the acetabulum. So instead of sitting at an incline, it's sitting kind of flat like that. So the forces just don't get distributed through the femoral neck as well. And if a patient has severe coxivalgia, you can see bowing out of their legs. So for subjective, for the atypical patient, the old frail lady, 90% of those patients are corticosteroid users, so think of how those medications will affect their bone mineral density and put them at an increased risk for this condition. And then sudden insidious onset of pain. For pain causing the need to stop the activity, pain at rest, and you're going to see non-specific pain of the hip, kind of anterior and the buttocks, and there'll be pain with weight bearing, just putting forces through the bone. And then in your typical presentation, patients who have increased their training intensity, so running mileage, duration, intensity, things like that. And the mechanism of symptoms, so your osteoblastic activity, which builds bone, is lagging behind the osteoclastic activity, which is breaking down bone. Muscle fatigue will increase the tensile forces and fatigue on the bone. So think of the increase in stress placed on the pelvis when transitioning from walking to running. And if you're running for long periods over long distances, your muscles are fatiguing, and instead of contracting and providing stability for the pelvis, they're getting tired, and more of those forces are going through the bone. So a stress fracture is a fatigue-induced fracture of bone caused by repeated application of stress over time.